Hello, and welcome to another episode of Right Brain Rounds. And today we have Dr. Bettina Paek with us. She is an OBGYN, doula, maternal fetal medicine specialist, and she is in the Seattle area. And today we're going to talk a little bit about how she created an app to help laboring patients. And this is in her role as a maternal fetal medicine specialist and doula. And so I'm so excited to welcome Dr. Paek to our program today. So welcome.
Hi, Karina. So it's so nice to talk to you.
Excellent. And so I know that it was really fun how we met in person because we've, kind of been colleagues from afar, being in Alaska and you being in the Washington, Seattle area. And, we happened to meet on an airplane at the very end of a trip. And I heard you talking about an OBGYN conference that I was also going to. And I was like, oh my gosh, we're meeting in person. It's so excellent.
Yes, we were both lugging heavy suitcases around.
Yes. And that was where you were going to present at the American College of Obstetricians and Gynecology conference about your new app called eDoula. So I'm going to let you take it away and tell us all about it.
Well, I kind of just want to backtrack a little bit and say a little bit about what kind of led me down this path of like, why is MFM caring about labor support? Don't you have other things to do, save lives and, just run the hospital or whatever. So my training is a little bit unique in that I'm German and I trained in Germany. I did my medical school and OBGYN residency there, and it's a very different system. It is set up with midwives and doctors co-caring for patients on labor and delivery. So there's no nurses on labor and delivery. Those functions are done largely by midwives. And then we as doctors, we would just follow along more in the background than anything else to make sure that nothing was going off the rails. But the primary care at the bedside was delivered by the midwives. And so they did a lot of positioning of the patients, they did a lot of emotional support, and they actually delivered the baby as well. And we would literally be in the room like the attending, just sort of standing there, making sure that everything was fine. So when I moved to the US for research initially in fetal therapy, which is my clinical niche, and I had to, I got married. And so, we had to make the decision, are we going to stay here? Are we going to go back to Germany? And we decided to stay here because my husband didn't speak German, and I at least spoke English. So I had a leg up there. I had to repeat my training. So luckily they accepted my medical school. I had to repeat all the board exams, but I had to repeat my residency. So when I started residency here, it really struck me how there's such a difference in terms of that midwifery supportive element missing, and how complex and complicated patients were here. I trained at a university hospital in Munich, which was a tertiary or quaternary referral center, and we were practically running a birth center compared to what I was seeing here. So just the level of complexity that is in the US, and that's due to a lot of social determinants of health, to lack of universal health care, to the fact that people move around a lot more and lose a lot of their social supports, the prevalence of obesity, diabetes, hypertension. I mean, you name it. It was just not the same. So we're not comparing apples to apples when we compare outcomes from Europe to outcomes from here.
Mm-hmm.
And I think we get so busy taking care of all the medical complex needs that we forget that we also need to enhance the normal physiologic process of giving birth. And I just really wanted to bring awareness to that and make sure that people have, look at both sides of the coin. Yes, people are medically complex and we need to treat their diabetes and their hypertension, but they're also people giving birth and we need to support them. We need to support the physiologic part of labor. We need to enhance oxytocin release, decrease their stress, help them with positioning, all those kind of things that are traditional birth support. And so as a way to really bring that to as many people as possible, that's why I created an app to say like, well, how can we really disseminate that information easily? How can people learn at home on their own? And how can we put that into people's hands when they need it?
And so in looking at the app and seeing how there's applications for people that are the practitioners, and then also for the patients, to kind of look and see how they can best help themselves in any clinical situation that comes up when you're laboring. So, I think it's such a wonderful education tool. And it's not only, coming, from the aspect of teaching patients, but also, teaching practitioners who are helping those patients through labor on how they can best, help them and progress that labor in a way that kind of helps those patients do what they want to do as far as like have a nice, successful vaginal delivery, even in a hospital setting.
Right, exactly. So I was department chair at Evergreen Health, which is a large community hospital, and actually maternity care was sort of its signature service line. And we delivered about 4,000 to 5,000 babies there a year. So it's not a tiny hospital, so a pretty robust service line. And I was, as I said, the department chair, and we were tasked with things to improve the quality of care, to decrease our NTSB C-section rate and enhance the patient experience. So like many other OBGYNs, I kind of scoured the available literature. What can we possibly do to do that? I mean, we were already doing all the things that ACOG was recommending, right? Letting people labor longer, calling active labor not 4 centimeters, but 6 centimeters, having people labor at home early in labor. And it wasn't really causing a significant difference in our numbers. And so I turned to the CMQCC toolkit to enhance vaginal birth and kind of looked at the literature from all other sources. And one of the consistent things that kind of popped up was that the lack of labor support kind of was the one identifiable feature that people thought was really missing in the maternity care system. In fact, in the CMQCC toolkit, out of the top 5 reasons as barriers for vaginal birth, they cite admission to the hospital in latent labor without a medical indication. They cite lack of labor support and lack of knowledge about coping techniques for the pregnant person themselves as well. And so, that's pretty big. And so who can provide labor support? Well, the woman or birthing person can support themselves. Now they rely on their partner or their friend or family for birthing support in the vast majority of cases. Of course, nurses can provide labor support, and A1 identifies that as an intrinsic part of labor support, and that we as physicians and midwives can provide labor support as well. Now, doulas, of course, are the ones that have championed this as being important, and we are lucky enough to have Penny Simpkin, who's one of the co-founders of DONA, or Doulas of North America, now DONA International, live in Seattle. So I got to be good friends with her and trained with people that she trained, and really saw firsthand when my patients had a doula, how much better supported they were and how much better they were able to engage with me in very complex medical pregnancies. Obviously as MFM, I don't take care of someone who's super low risk and who could be delivering at a birthing center. I take care of moms who've had previous pregnancy losses, who have been through the ringer in their pregnancy, and having someone with that support help them navigate things, help them really enhance what was normal. One of the patients that taught me so many things, and of course, our patients are always our greatest teachers, is a woman that I had met for her second pregnancy loss at 24 weeks with an abruption, chronic abruption type loss. And, for the second time to have that happen, that's pretty devastating. And we diagnosed her with antiphospholipid antibody syndrome, the really bad kind. She actually ended up having a stroke after that as well, and saw a hematologist and was on full dose anticoagulation. And still wanted to build her family despite those known risks. And so I saw her for the next pregnancy, and we decided to induce her labor at 37 weeks because we just, at that point, didn't want to risk that placenta kind of giving out on us again. And it would have been very easy for her to give up and say like, oh my God, 37-week induction, cervix isn't ripe. This is going to take forever. I'm going to get an epidural and then I'm going to labor for 3 days. And then, it's all going to end up with a C-section. But she didn't. She hired a doula. She had a birthing tub brought to the hospital, and she had an amazing birth. Just because she prepared well and she really enhanced everything that was normal. And so that was kind of one of the things where I was like, well, this woman needed medical care, but she also needed that supportive care. Now, not everyone can afford a doula. And so who else is already on the ground caring and loving a pregnant woman and really able to provide that support? And that is us as physicians, midwives, that's nurses, and that's their partners. But apart from midwives, who I think do receive some training on that, it wasn't part of my curriculum. nurses in nursing school are often not taught, and they have to go out and kind of take separate courses to really gain that knowledge and learn from their more experienced colleagues, but it isn't part of the regular curriculum. And certainly for the partners to try and get that information is not that easy either. So how can we create a tool for all of us who want to be more supportive but aren't really taught how to do it? And so that's why I created it's two apps actually. It sort of started out as one, and then we realized that really caregivers have different needs in terms of supporting pregnant women than the family does. And so that's why we created the caregiver version.
That is totally awesome. And I think it would be a really wonderful thing to study to see how COVID affected people who were birthing by themselves without that, social support or support in general. Because I know that at some points in time during the height of the COVID pandemic, at least in some of the institutions that I practice in, that people couldn't have partners there or had to be alone. And, how did that affect C-section rates or, successful vaginal deliveries?
Yeah, or just the
Yeah.
experience of birth. I
Yeah.
mean, birth is obviously it's a medical event and things can go wrong, but it's also such a big life transitional event where you go from being a person to being a parent, you go from being a couple to being a family. And we remember that. Penny Simkin did a study where she interviewed families and women 20 years after they had, or roughly 20 years after they've had a birth, and they remembered exactly that day. It's not just vague. But the interesting thing, what they remembered and what really made the quality of that day for them wasn't whether the epidural worked or not, and even whether they had a vaginal birth or a C-section. It was the quality of the interaction with their caregivers, whether they felt supported, whether they felt heard. And that was much more important than the actual outcome. So I think we can't understate as well how we set the tone for how people start their parenting lives. And for us, it's just another day at the office, but for families, it's a day that they'll remember forever. And I think that's just really important to keep in mind.
Yeah. I mean, even as a maternal fetal medicine OBGYN specialist, myself, really having to remind myself that this is a major life event for people. It's not just, some random day. And, to take that home with me and, when I'm talking to them about their baby, to make sure that, I tell them that I give bad news a lot, but that, I'm there for them, and, to talk with them about everything that they're experiencing and ask about their feelings and say, I know I'm talking to you about something that's going on with your baby, but if you have any questions, just let me know. And, kind of that trauma informed type care, and supportive care. So, I think that's something important to bring up, that these are major events for our patients, and we have to sometimes remind ourselves of that.
Yeah.
Yeah.
And that's why people write elaborate birth plans. And, I often hear other people complain saying like, well, they wouldn't come in with a plan for the appendectomy, that they want mood lighting and this, that, and the other. And they do come in with a plan for their birth. But that's because an appendectomy isn't like a life building event, and birth is different, and we have to honor and respect that. Now, of course, we want to keep things medically reasonable. But I think it's desirable for people to kind of think about how they want their birth to go. Now, I want them to focus on the power that they have. What can they do? What can their partner do? How do they want to communicate? So all things that are within their control, rather than focusing on what they want you to do and not do, and sort of microscript things that they want done and not done. But oftentimes these really long birth plans are also the sign, you mentioned trauma-informed care, they're the signs of previous trauma. I think we've all seen those 10-page single-spaced birth plans that kind of call out details like, don't play me seagull noises, or other things where I'm like, I never would have thought about seagull noises, but I don't know what the association was. I'm sure something happened to this person to make her put that in the birth plan. I don't know what it is, but I think we can take that and gently refocus them to really have it be a more empowering experience.
Yeah. And even just, telling them that you do totally appreciate their birth plan, and, asking a lot of questions about it. I think that's very important too, because then that shows that there's an open dialogue, and that they're not being judged for this birth plan, and that, we as practitioners are willing to work with them on that. I think that's important too, so that they know that they're being heard and recognized. And like you said, sometimes when we lose control of situations just in life and they become traumatic, grasping for that control in future situations is, maybe a way that, people can move forward in their lives, knowing that maybe they have some more control of, future situations that are particularly scary, if they've had a bad outcome in the past.
Yeah.
Yeah.
Yeah, that's why we created, a tool, calling it a birth plan builder. So in the app that really focuses them on what they can do to make things go as well as they possibly can. So focuses on how do they want to set up their environment? What do they want to bring from home to kind of appeal to all the senses? What comfort measures are they going to use? And then we teach them, how to do those comfort measures. What positions are they going to use? We teach them how to do the positions. What massage techniques? What breathing techniques are they going to use? So rather than them saying like, oh, I want you to do this, this is like, okay, here are the things that I can do. These are the things that I can practice ahead of time. I can practice them with a support person who's going to be there. And then, of course, we want to educate too about possible interventions that might be discussed, like induction or AROM or cesarean birth or epidural, for them to just be able to say ahead of time, like, yes, I've heard about this and I know that this might be discussed. And for them really to come to the table being able to ask the right questions, like, what are you as a doctor worried about? How likely is this to happen? When we talk about risk, we often have to say like, well, what's the likelihood of it happening and how bad is it if it did happen, right? And so that they know that these are kind of the categories that we think about risk for when we talk about interventions. So just to be better prepared and to be able to focus on what they can do.
Yeah. And then, also just asking them, what would the perfect outcome be for them? In talking about what we're trying to avoid, why is that? And, knowing their history and being able to ask about that in a way that, doesn't bring up the trauma again, but, kind of proves that you're a caring and compassionate physician who's trying to get to the bottom of why they're feeling the way that they are feeling, and trying to avoid those situations in the future. So I
Yeah.
think that's a great thing for this app, because that can be done in a way that's very neutral. The people might be more willing to go to an app for help than to ask, during a birthing process. Maybe they're afraid to ask questions, or maybe they don't know which questions to ask. But if you, in your experience, have experienced those commonly asked questions in patients who have had, horrible histories, you put it in an app, and then those patients are like, oh, that's a great point. I never thought to ask that, but Dr. Peck thought about it and put it in the app. So
Yeah, we'll actually we have some
Excellent.
free blogs on our
Excellent.
website too that people can see. So how to make a great birth plan and how to minimize your risk of vaginal tearing, and more going up soon. And sort of the three basics of labor support, which is how to support your mind, your body, and then movement as well. So those
Yes.
are all free resources that we have too.
Yes. Oh, that's wonderful. Now, have you talked to some people who have used this app?
Yeah,
And,
yeah, we have.
from the
So we've been.
clinician side and from the patients?
Yeah, absolutely. So from the patient side, we provide a lot of postpartum help as well. So I think people find it helpful in, as you say, sort of making the birth plan, and even kind of when you're going through these things, saying like, oh, which techniques can I use? How can I get my partner involved? And we often know that the partner, the dad, is kind of looking there and looking rather helpless, and I think wanting to help but not really knowing what to do. So really giving them the tools to kind of jump in and say like, oh, hey, I know this massage technique, or I know I can hold your leg when you're pushing, these kinds of things. I think partners have really appreciated. And at the postpartum help, surprisingly for me, a lot of people really appreciated kind of sort of the basics of that as well, being able to troubleshoot breastfeeding in the middle of the night when you just don't want to call for help, and saying like, hey, am I doing this latch thing right? What should it look like? Or how do I bathe the baby? Being unsure about things, and knowing that this is a trusted resource and you're not just Googling random people on the internet. I mean, none of this information is completely new. A lot of these birthing positions and a lot of these comfort techniques and measures have been around, in fact, for centuries. I'm a total history nerd, and so I was listening to a history podcast, and they were saying that the oldest profession in the world is indeed childbirth attendant, contrary to what most of us might believe. And I think that makes total sense to me, given how complicated things are. But yeah, people have really appreciated the collaboration of doctors and doulas, because that's ultimately what it is, right? It's based on evidence, but it's done with doulas. So we collaborated with Penny Simpkin for a lot of our content, with some other wonderful doulas in the community. And then we pulled in pelvic floor physical therapists and lactation consultants as well. So it's doubly vetted information, if you will, delivered in an easy to understand format. There's short videos, there's short description, there's practice modules that are all really, really short. They're about 2 minutes. So with just a few minutes of practice a day, you can really get yourself to a point where I think you can be confident laboring at home and be confident that your partner is going to be able to support you.
And I think also that focus on the postpartum aspects of, having a baby, that's really important, because I don't think we learn about that enough as OBGYN residents, physicians, and, in addition, I know that, being in residency and not having had children myself until I was a resident, I thought, oh, okay, this is wonderful. I'm learning all about this. I know pretty much what's going to happen in labor. But when I did end up having my children, especially my first child, I had no idea what was coming for me in those 6 weeks postpartum.
Yeah, we just don't know what to expect, right? And I think, you get so busy just preparing for the birth as well, and, getting like the material things that you think you need for a baby. Then you kind of go home with the baby and everyone pats you on the back and says, good luck with that now. And
Yes.
then we're like, wait, what? I'm supposed to keep this human alive for like the next 20 plus years? Like, how do I actually do that? Yeah, so just sort of the basics, even to like, hey, here's what a good latch looks like. Well, what if, what if it hurts? Like, what else can I do? How do I correct this? How often is this baby supposed to eat? What's the poop supposed to look like? Right? What's normal? How often are they supposed to pee? So all of that, I think, is not really taught very well. As I mentioned before, we get taught the pathology and how to fix that. We don't get taught the normal as much, and how to enhance the normal and just, make that a little bit more efficient, and just really take the fear out of it.
Oh, yeah, of course.
Yeah,
And so when you collaborated with other doulas, I mean, you have had official doula training
I have.
yourself.
Yes. Yeah.
Yeah, tell us about that.
Well, I just wanted to know more about that. I have official doula training, and did that with Kim James, who trained with Penny Simpkin. And I've accompanied some patients that along that we're delivering at a hospital where I don't practice at, to where I don't deliver at,
Mhm.
to be their doula. And it's kind of eye-opening, really, when you're just in that different role, and to see how much time people really spend alone in their room, even though we think like, someone's always with them. But there's pretty long stretches where the nurse isn't in the room, where the provider kind of just occasionally comes by. So it was really quite interesting and eye-opening to see that there is like all that white space in between, where they're having to rely on themselves, really.
And so when you were writing content either on your blog or in this app, um, did you probably used a lot of your personal experience, but what other avenues did you use to create some of these, different positions and, information that you put in the app and on your blog?
Well, first, like, of course, scour the literature and saying, like, what's supported by the evidence, right? So what does that look like? And then, in terms of what the positioning looks like, so that's kind of where I drew on the experience of the doulas, and that I was working with, really.
So if people want to upload this app, where do they go?
They go to the App Store. It's called eDoula for Families.
Mhm.
And then they can try it for a week for free. And after that, you can choose to buy it for a whole year. So that's the entire pregnancy. We have content starting as early as preconception, no, not preconception, but pretty much post-conception. So, and then through 3 months postpartum. So for 50 months for the entire year, for $10 a month, or $9.99. And they can add 3 support people too. So it's really an app for 4 people. that you get for all of that. There's no extra price for adding support people to that, so that they can see the same content. You can share content with them additionally. So if you're like, oh my God, that foot massage looks amazing. I don't know if you've opened the app today, honey, but here it is. That's what I want tonight. You can additionally highlight content by sharing it with your support team. Now, the caregiver app, so far I am doing with partnerships with hospitals. And it has some really fun features as well, because it sort of has more of a focus on labor, of course, because that's where labor nurses specifically would use it. And so you can search the content by, if labor is slow, specific things, like depending on where the baby is in the pelvis or what position the baby is. So we have a focus on correcting malposition, and there's even an algorithm in there where you can choose labor is slow, my patient has an epidural, what's the station of the baby, what's the head position, is it asynclitic, is it OP, LOP, ROP, and then it comes up with a sequence of maneuvers that is sort of a starting recipe for trying to correct malposition. But then also has all the support techniques in there as well. So just a different search function.
That is so awesome. And so if someone is working at a hospital, either a nurse or a physician, if this is someone that wants to make sure their program has the app, how do they go about doing that?
They email me at info@edoula.net or Bettina@edoula.net. Either of those is fine. So yeah, and I'm happy to set up a workshop at their hospital. That's other things that we've been doing lately that's been quite popular. So I've given a talk at ACOG and at Skills Workshop at the A1 meeting. So for those who don't know, A1 is the big association of women's healthcare obstetrical and neonatal nurses. I did a workshop there with Penny Simpkin and with one of the doulas that I've worked with a lot with, Kate Dewey, and that was super popular. I've been asked to kind of take that show on the road. So I'm always happy to do that and do sort of a hands-on workshop as well about labor positioning, but really just giving an intro, saying like, why is this important? What problem are we trying to fix? What's the evidence behind it? Because I think that's what, as a physician, I can really bring to the table, is provide the context for why these techniques are important and what the evidence shows us.
And, I think it's very important to know as well, and, we've talked about it, that you are a doula and this all is evidence-based, so those two worlds have a lot of crossover, and, to provide that to patients and to their, practitioners is an awesome way to, help the patients advocate for themselves and, attempt to get that vaginal delivery and avoid an operative delivery if that's the safest route for them. I think that's really important to know that being a doula and doing those techniques can be very evidence-based and beneficial to everyone involved.
Absolutely. And I think, there's always a little bit the mystery of like, well, what does a doula actually do? And some people say like, well, studies show that a doula reduces C-section rates by 30%, which is true. And which is, of course, lovely amount of data. If there was a drug that would do that, we would be all over it, right? But I think we could demystify a little bit, saying like, well, what did it actually do? How does this work? Like, open the hood a little bit and see how the motor functions. Like, what components of that doula care are able to be scaled a little bit easier than others. Now, having an in-person doula is always going to be the gold standard. But that doesn't mean that we can't take some of what doulas do and try to empower other members of the care team to do the same thing. I mean, it's kind of the same thing as like, do we not want to give people recipe books to cook at home because, they can't dine at like a fine dining restaurant? So yes, I mean, the best thing possible is still always going to be an in-person doula. But again, we still want to give people the tools to be able to cook at home.
Mm-hmm. And, I think it's so awesome that you've thought outside of the box and, obviously you've got a lot of people that are supporting you in this, endeavor, in getting the app out there. I mean, it's a lot of work on your part as well, but, to really think outside of the box on how can evidence-based, techniques and tools be given to people in all realms of pregnancy, whether they're the patient or the practitioner, and really improve outcomes and put that out there to the world. I think it's just such a unique way of doing it. I mean, yes, there's an app for that, right? So labor, doula, there's an app for that. And, I think it's just so extraordinary that you have been able to do that.
Yeah, it has been quite the journey, I have to say, with some more challenges than I thought, but also much more rewarding than I thought. And I've learned so much in the process. I mean, I learned a lot even creating and producing all the videos because there's some details where I'm like, oh, yeah, I didn't know how to size a nipple shield. I didn't know like all those kind of little details. And yeah, I knew somewhat about the positions, but not exactly. So this is how I explain it to, my patients. And here's sort of the little tips and tricks to really make it easy. And here's how the partner can hold the leg. And here's that extra pillow is going to be helpful. And oh, I only do this, you only need to be in this position for like 3 minutes rather than 20 minutes, right? So I think there's sort of, even if you know a little bit about it, so if you drill a little bit more deeply into it, there's definitely always more nuances to learn.
And I know I counsel my patients all the time about, if they're afraid about delivery, to just make sure that they're asking questions. And but then, back up and say, oh gosh, they might not even know which questions to ask, but you've got it all outlined there in the app, which I think is excellent.
Yeah. And I think what I really want them to consider too is what's really important to them, because that's going to be what their North Star is during the birth. And that might be different depending on what their circumstance is, right? If you've had a previous NICU baby, then having that baby that was whisked away right after birth and really just having that baby on her belly is going to be your main priority. If you're a survivor of sexual assault, then, it's going to be something completely different. Just having the sense that you're still in control might be the most important thing. And you might not want an epidural because of the feeling of being not able to move around freely. I mean, I think I want people to consider those things and not just like, oh, I want a vaginal birth, but yeah, what else is really important to you? Because then, a lot of it flows from that. We have so many folks who say like, oh, I don't want Pitocin, but then you have to really dig deeper and say like, well, what does that mean to you, right? Are you worried that the contractions are going to be more painful and that you won't be able to cope? And so just for us really also of asking questions when people have these requests so that we can kind of get to the root of them, say like, how can I still honor that even if I think, the right answer is augmentation with Pitocin? What's really behind that request?
Yeah, yeah. Well, all of this just sounds so fascinating. And, to be able to use an app in real time, um, in a hospital system or at home, I mean, I think is going to be so beneficial to these patients. And I'm actually looking forward to, because I know you're probably going to do this, but the research of how this has actually helped people in labor and if it has had an effect on C-section rates, in real time, looking at people who have used the app.
Well, we haven't really, we don't have the numbers yet to be able to prove that it reduces C-section rates. I'm certainly hoping to partner with a hospital institution to kind of study exactly that, because if that requires an
Yeah.
IRB and study data. So if anyone's listening and wants to trial this in their hospital and wants to actually study it, contact me. What we have seen is that people have liked using it, that they would use it again in a subsequent pregnancy, even though you'd think like, oh, then now they already know all the techniques. No, the vast majority would use it again in a subsequent pregnancy, and that they use more positions in labor. So that's kind of what we've learned so far in our pilot project with a few hospitals. So that's encouraging. People like it. They're using it. They're using more positions.
Mhm. And it's very affordable. And, to have that access, even up to 3 months postpartum, I think is excellent because, I'm sure there's plenty of questions that come up in that realm of, the postpartum pregnancy, timing. So, yeah, this is just excellent. I want the world to know about this.
Yeah. So the next thing that we want to do, just to give you a roadmap, is we really want to have a personalization feature where you can text a doula or I guess have a virtual visit with a doula so they can, or lactation consultant, so you can really troubleshoot what your unique problems are. I mean, an app, or it's sort of the app equivalent of a book, if you will, can take you so far, but then you're like, well, I've tried all the things, I still have questions. We want to provide that next level of expertise to families. So hopefully that's coming relatively soon as a pilot project.
That is so spectacular. And I think, I have a passion for providing care for people in rural areas. And this seems perfect for people who are not anywhere near, a population hub, to be able to contact a doula. I mean, maybe there are some doulas in different, communities that are rural, but to think about someone who might not have even the best internet access, but they're able to get an app and use their phone, and get in touch with a doula, no matter how far away they are, to get some information. So, definitely meets up with some of my passions in my medicine journey, to help people in more rural areas. So I can see how that would be very important to those populations.
Absolutely. And I think we also want to pair people with doulas from their community, and they might not be always easily available in their community, especially as you say, if you're in rural somewhere and you're from a specific community, let's say Ethiopia, and there's not a lot of folks from your community around there, then how do you connect with someone who really understands your cultural background? I think I would love to also, and again, this is kind of the grand vision, give doulas another avenue of working. Doula work is hard work. They have to be on call pretty much 24/7 for their clients, and you just don't know whether you're going to be gone for 3 hours or 36 hours. There's just no way of telling. So it's difficult with childcare. So the rate of burnouts are quite high. They also don't get paid great. And I think with insurance companies getting into the mix, which is awesome, I think they're going to put downward pressure again on reimbursement for doulas. So I think finding other models other than the traditional model of doula care, which is in-person one-on-one, I think is going to be beneficial for everyone, really, to say like, well, okay, maybe that traditional model is great, but not everyone can afford that. How can we still scale it in a way that's just doable and affordable for more people? Because the medical counterpart to that is having concierge primary care, which is great. Everyone should have a primary care physician that they can call at any time, but insurance doesn't pay for that. And so the equivalent would be to say like, well, no, you can't talk to a doctor at all if you don't have concierge care. So, well, no, there's still a benefit to that. So can we replicate a different model and just think outside the box and see what benefits we still can get?
So all of this just sounds totally amazing. And I love what your future visions are, for this app and for the patients and practitioners that it will positively affect. So I'm going to make sure that, all of your contact information is in the show note area, of the Right Brain Rounds, so that people can get in contact with you, download the, app if they, need to find it at a later date, and, look at the pricing as far as like, getting it as early as they can in any future pregnancies. So I think, this is just excellent.
Well, thank you. Yeah, I'll give that to you. And, if you want to support us in a small way, you can follow us on the socials. We are just sort of launching a socials campaign. So I think just getting a little bit more eyeballs would really support our mission.
Of course. And so if anyone has any questions, please either let myself know or, get directly in contact with Dr. Paek. And I'm just always amazed at everything that you have been able to do in your career as a maternal fetal medicine subspecialist, a doula, and OBGYN. So I thank you very much for being a wonderful colleague and asset to, the world community.
Well, thank you so much. You've been a wonderful friend and sort of person to bounce things off of and ideas and fellow entrepreneur. So it's always such a pleasure to talk to you.